patients who have a history of irritable bowel syndrome, migraines, PTSD are more likely to get long COVID. You won't have seen this in the literature yet because I haven't seen it yet, but this is something that I predicted at the beginning of the pandemic. And I can tell you that in my patient population that I see, it's virtually 100%. So patients who present with chronic fatigue syndrome, it's almost never a disease of isolation. 70% of them will also have fibromyalgia. 25% of them will also have IBS. 25% of them will also have migraines. 30% of them will also have pelvic pain syndrome. And so those conditions fit together under the family name of central sensitivity syndromes. It's not a separate syndrome. Some people don't like the name. Doesn't matter whether you use the name or not. Just to say that in my practice, and I've seen almost 8,000 patients now, is that the average is 5 to 6. And if I see a patient with isolated chronic fatigue syndrome, it's usually very mild and they have a really good chance of recovery. The more central sensitivity syndromes that you have, and the most that I've seen in a single individual is 14. And so the average is 5 to 6, the high end is 14, and usually the low end is 2. Very rarely do I see just chronic fatigue syndrome or just fibromyalgia without at least tension headaches, migraines, irritable bowel syndrome, interstitial cystitis, pelvic pain syndrome, TMJ, POTS, et cetera, et cetera.